Hello friends, I am Dr. Mateenuddin Saleem, Chief Consultant and Head of the Department of Pulmonary and Tuberculosis and Sleep Medicine at Sunshine Group of Hospitals. Today, 24th of March, is regarded as the World Tuberculosis Day. This is declared as World Tuberculosis Day because on 24th of March 1882, Robert Koch, the great German microbiologist, this day is actually labeled to bring awareness amongst masses for this devastating and dreadful disease which has lot of health, social and economic burden on the face of earth. Cause of tuberculosis was identified. The disease tuberculosis was more rampant in Europe and Americas. 1 out of 7 people were dying over there, but it was relatively less in the developing world, that is especially India, where the hygiene was much better. This disease is easily diagnosable and easily treatable condition. Therefore, I suggest the responsibility has to be shouldered by every citizen of India to see that the people suffering from this disease should be diagnosed early and treated fully so that the disease no more spreads rampantly in the community. If any patient suffering from vague ill health, persistent fever, loss of weight, loss of appetite, cough, expectoration for more than 4 weeks time, we should be cautious and take that patient to healthcare facility to check up whether that person is suffering from tuberculosis. One thing I would like to make clear now, tuberculosis can affect a human being any part of the body. It can affect the brain, it can affect the bones, it can affect soft tissues, it can affect muscles, it can affect lymph nodes, it can affect throat, it can affect any part of the body. But lung tuberculosis is very important because when the patient coughs, the tubercle bacilli are discharged in the form of droplets in the atmosphere, and if those suspended droplets are inhaled by other individuals, then they also may get infection. It is not necessary that all the people infected may get the disease. It is our defense mechanism which takes care of the infection, but only a few people whose immunity is less can develop active disease. And even then, that is also completely curable provided appropriate treatment is given for the appropriate time. One problem which is happening is, if the patients are not regular in taking the treatment, over a period of time people can develop multidrug-resistant tuberculosis. Means the regular drugs which are used to treat this disease successfully may not control the or kill the organisms sufficiently. In that case, expenditure of the treatment and the duration of the treatment increases, and when we give second line drugs, if the patient develops multidrug-resistant tuberculosis. The World Health Authorities have found that from late 90s onwards, the incidence of multidrug-resistant tuberculosis is also increasing enormously, and it is estimated that in the year 2015, about 500,000 people were suffering from multidrug-resistant tuberculosis, and if latest statistics comes, the figure may be still higher. So, my message to all of you is maintain good hygiene, keep a watch in your surroundings. If anybody is suffering from prolonged fever, prolonged cough, take them to health authorities for thorough checkup and diagnosis if at all they are suffering from a disease like tuberculosis, and if it is proved, then they should get appropriate treatment for the complete duration. Thank you.
Sunshine, it's our sunshine.